first of all, I'm going to check for any inflammation, infection with my probe. So everything's nice and healthy. There's no pocketing, no bleeding. There's no redness, no swelling, no suppuration. So I'm looking for deposit as well. There is a very minimal amount of deposit. I'm going to apply some disclosing solution just to check that the oral hygiene is effective around the implants to protect them from the disclosing, but we have the retractors on. So I would disclose all the buccal and all the lingual aspects. Finally, I'd finish by polishing with a non-abrasive paste.